Hi everybody, this is your classmate Jess Urenko, and my alternative therapy demonstration is going to be on yoga, specifically chair yoga, which is kind of ironic because my very first experience with yoga back 20 years ago when I was an undergrad at Penn State, I took it as one of my requirements for gym and I absolutely hated it. It felt like I was in with a bunch of other athletes and they were doing handstands and headstands and doing all these crazy poses. And in the meantime, our instructor would be like, do what you feel comfortable. I didn't really feel comfortable to do anything. So, throughout our coursework, there has been some mention of yoga, and I've read about, the use of yoga as a therapeutic tool, but I just never made that connection how that would work, considering I knew how uncomfortable it had made me feel. So this summer, while doing my internship, chair yoga is utilized in a bunch of different areas. We use it with their families after they've been in session all day through educational programs with us. And when I was working on the senior floor, which is obviously people 60 and above, that's how they start their morning every morning. They eat their breakfast and then they come down at 9 o'clock and they do a 45-minute chair yoga routine. So I retried yoga through chair yoga, and I absolutely loved it. Just obviously I didn't feel so self-conscious with the company I was, and it just was a great way to start my morning that wasn't exhausting. I wasn't, I could still be in my work clothes, but kind of just had a nice calmness, yet I felt energy. So throughout our coursework in this course, we've learned all about the mind-body connection and how beneficial it is for our clients who have been survivors of trauma to be able to make that reconnection with their body. And I think that this is a great way to maybe get a client who is just new in the area of yoga, just to get their feet wet and start, because you can do it anywhere in any setting. You just need a chair. You don't have to be dressed specifically for it. You just need to be comfortable, and you don't need any kind of ability. So it's a great way to start just kind of getting acquainted with yoga. Okay, so here we are. We have our chair. We want to get comfortable. Just to clarify in the last portion of the tape, I did my internship at an inpatient facility for drug and alcohol treatment. So when I was referring to families came in to be educated on their patient. And when I talk about the seniors, those are seniors who actually came in for drug and alcohol treatment in an inpatient facility. So that was probably I was most fascinated in that department at how profound the changes were in those people. But back to the yoga, we're gonna get started. We're comfortable, we have our chair position. You want a nice sturdy chair that you're not gonna knock over by leaning or anything like that. You want your feet on the floor. We're gonna start knees just kind of like same align with our shoulders. Just start by getting our energy flowing by rubbing our hands together. None of this will be too complicated. These will be things that you can do in an office setting. You could do it at work. I know I like to do it when I'm stuck, like one of those days where it's just like a paperwork day and my body starts aching from sitting in the same position for too long. I'll do some of these poses and movements just to get my blood flowing. Okay, and throughout this whole thing, a couple of our other classmates had concentrated and talked about breathing, so I'm not going to get into that too much, but you want to be concentrating on your breath, making sure that you're breathing in through your nose and exhaling through your mouth. Okay, the first one we're going to do is just something simple. We're going to put our head, look up, and put our head down. And we're just going to do some simple head rolls, neck rolls rather, 5 on each side, whichever side you feel most comfortable to start with. 2, 3, And you can just kind of loosen up and shake it out in between. Make sure too that it's light movements. We're not jerking in any way. Just kind of relaxing movements. And we're going to start with the other side. Head up and down. 1, 2, 3, 4, 5. And again, you can alter this any way you want. You could do, 3, you could do 10, whatever you feel most comfortable or you have the time to do with your client or if you're doing it yourself. Okay. Again, just try to remember, it's hard to, count and focus on breath at the same time, but make sure you're focusing on your breath. Okay, so your hands are on your knees again. This time we're going to do shoulder rolls. I'm going to start with either side. I'm going to start with my right side, and it's 1, 2, 3, 4, 5. I like to shake it out in between. 1, 2, 3, 4, 5. And again, I'm kind of going through this a little bit quickly for sense of the tape. You can take your time with this. I'm kind of doing as an abbreviated form. This would usually be about 45 minutes that we would be spending doing this on campus. Okay, both shoulders. 1, 2, 3, 4, 5. Okay. Now the next thing we're going to do, this kind of stretches out all your back muscles, also helps with the shoulders. You're just going to kind of lean over and you're with your whole body, first through the right, all the way around. 2, 3, 4, 5. Okay, and back to position. And then the other side. 1, 2, 3, 4, 5. Okay, and breathe. It was great to watch and do this with the seniors because they all had different abilities, but everybody was able to participate at one level or another, depending on, we had clients and patients who were 80 and were able to participate in this, whereas we had people who were 60 and they were still running and they're still very active. So again, you could really kind of gear this to meet your audience, or they can kind of do as they feel comfortable. All right, the next thing we're going to do is we are going to put our arms both to the sides. And again, this is one of the things, some of the clients, they'd only have one arm out at a time. If you could have both out and stretch out as far as you can. And start with the right wrist. And twist it from front to back. 3, 4, 5. And then the left. 1, 2, 3, 4, 5. And you do both. 1, 2, 3, 4, 5. Okay, and then gently bring your arms down to your side. Again, try to concentrate on that breathing. And then we're going to do some reaches. We're just going to start, I'm going to start with my right arm. You can start wherever you feel comfortable. 1, 2, 3, 4, 5. And the other. 1, 2, 3, 4, 5. You can bring your hands back down your lap. Deep breath. And try to, concentrate on your belly and use your the inner breathing there. Okay, then you're gonna stretch out your leg. Ankle rolls. 1, 2, 3, 4, 5. You could alter this and you can stretch out that way and do it that way. 1, 2, 3, 4, 5. Bring it back in. 1, 2, 3, 4, 5. And again, stretch out. 1, 2, 3, 4, 5. Okay, then we're gonna incorporate arms and legs, and we're gonna kind of do like a chair march. Okay, I'm gonna start with my right, so you use your right arm, left leg, left arm, right leg. I'm gonna start right arm. 1, 2, 3, 4, 5. I'm gonna start back with this one. 1, 2, 3, 4, 5. Okay, and then we're just going to end with some breathing. As we breathe in, we're going to arch our back, and as we exhale, we're going to arch our back the other way. Okay, so we're going to arch this way, then this way. Breathe in. Breathe out. Breathe in. Breathe out. And one last breath. Breathe in. Breathe out. Okay. I hope you feel energized and relaxed all at the same time and in comfortable with your body.